welcome everyone in the day one, and then it promises to be an amazing day. So welcome, battle up and enjoy. Also, I think something that is important, I'm sure you want to know why we are gathered here today, just to share some of the objectives of the summit. I will start just an introduction on the Evidence to Policy Summit objectives and the agenda. This is a momentous summit that brings together experts, policymakers, researchers, stakeholders from around the globe to explore evidence-informed policymaking. And the objectives then of this session, this is what we aim to achieve by the end of the 3 days. We want to be able to identify country needs and areas of support required by the network members from WHO and its partners. And also we would like to take a moment to take stock on recent global, regional, and country-level activities towards implementing the EVIPNet call for action. And this space also will provide for exchange and deliberations on good practice and gaining new technical insights, thereby strengthening the network cohesion. And lastly, we are going to be launching the Coalition of Partners. And then through the keynote remarks, the panel discussions planned for today, networking opportunities, we aim to inspire innovative approaches and also provide practical insights to catalyze evidence-informed decision-making and build collaborations that promote trust in science. Just to take into account our global audience and time differences, the summit will be on for 2.5 hours every day for the next 3 days, which is the 29th to the 31st of August. Please do join us. And just to share a bit of the agenda for the session, I think during this session, we have participants from diverse backgrounds, regions, and genders. We will have 3 keynote speakers today, and then the first 2 will speak to us will speak to us earlier in the day, and the last one will give us the final remarks of day 1. We are so glad to hear from Sir Patrick Vallance, the former Chief Scientific Advisor of the UK government in the United Kingdom, and he is currently the chair of the Board of Trustees of the UK National History Museum. And also we have our renowned Professor Salim Abdul Karim, who is the director of the Center of AIDS Program and Research in South Africa. In short, is called CAPRISA. And lastly, we have our Honorable Minister of Health from Chile, Dr. Jimena Aguilera Sanwenza, who's going to give us the last keynote address. Without further ado, I would like to introduce Dr. Jeremy Farah, who is the Chief Scientist, who will deliver an official welcome note for this event. Jeremy has a diverse background, having served as a director of Wellcome Trust for 9 years, overseeing the reform of global collaborations in areas of infectious diseases, climate and health, and particularly as well mental health. Prior to this, he has spent over 17 years directing the clinical research unit in Ho Chi Minh City in Vietnam, focusing on various infectious diseases and non-communicable illnesses. He was also a founding chair of the WHO R&D Blueprint and the International Severe Acute Respiratory and Emerging Consortium. And he also led on the work of the recovery trials and the UK COVID-19 Genomic UK Consortium. Jeremy is trained in neurology and infectious diseases and also holds a PhD in immunology. Now, with that introduction, I would like to request Jeremy to take the floor and officially open the World Health Organization second Global Evidence to Policy Summit 2023. Over to you, Jeremy.
Thanks very much. That's a wonderful introduction, but certainly stretched some of the, not sure where that bio came from. Many others, certainly on the recovery trial, far more involved than I was. But it is a huge pleasure to join what was a wonderfully enthusiastic opening. And we all share that enthusiasm, but also the importance of this topic. And perhaps just start by thanking everybody who's made this summit happen. It's always bad to pick out one or two people, but particularly Tanya at WHO and also John Reeder, who has been so supportive of this, but also my predecessor, Samir Saranathan, who left as chief scientist at the end of last year before I started. But it was certainly Samir who started this work on ensuring that WHO had at the heart of it both science, but also ensuring that science was accessible and available to policymakers around the world. So huge tribute and thanks to particularly, I think, those three individuals, but also to everybody that's joined. I think I'm right in saying that we had over 3,600 people or organizations registering to join the summit. And so I think that just tells you just how important and what a really important moment, I think, in global science and global health this is. And of course, in many of these opening remarks, we talk about the lessons from COVID, but in truth, it goes much deeper than that. And COVID certainly demonstrated, perhaps more starkly than at other times, but this has been an issue that has been in need of catalytic and support for many, many years. And I think it's an amazing reflection of the number of people interested in joining this discussion. So thank you very, very much. And particularly thanks to our keynote remark speakers. It's great to see Slim online. Slim is also part of the WHO Science Council, Minister of Health for Chile, who will close the dealings, and Patrick Vallance, now chair of the Natural History Museum, as you say, but also steeped in experience from many years of advising as chief scientist. I'm joining this call from Delhi, and it's potentially, I think, important just to put the context of why I'm here. For the first time, the G20 has organized under Indian presidency a gathering of the chief scientists of the G20 nations. That was on Sunday and Monday of this week and finished last night. I think it's also a reflection of how important at the G20 level, as well as at all the member states of the World Health Organization, just how important this issue is of science, of evidence, and the role it plays in our culture, in our societies, but also in our policy making and our politics. I've been chief scientist at the World Health Organization now for almost exactly 100 days. It's been a transition, a culture shock, an enjoyable ride so far, but also speaks to the challenge of coming from a science background and then working in a big philanthropy and then into the more policy arena. And I plead with everybody who is either in the science world or in the policy world to just think about how we best bridge that interface. A great mentor of mine from Edinburgh when I was training in neurology taught me that it was at the interfaces between disciplines, at the interfaces between cultures, at the interfaces between areas that perhaps don't sometimes work together as closely as they could, that real progress is made. And I think that's particularly true in the arena of science and policy. The world faces enormous challenges. Every country at the moment, of course, is going through the peri-pandemic period where the public health emergency has been declared over, but the COVID has not gone away, of course, as we all know. Health systems and health services around the world have been stretched almost to breaking point, or sometimes to breaking point, and healthcare workers around the world, I think, are shattered and in need of picking up. But it's and the world faces huge challenges of long-term trends, demographic shifts, climate change, drug resistance, the pandemic era, the continued threat of infectious diseases, but the coming of multimorbidity and non-communicable diseases, all at a time when countries economically and financially are also hugely stretched. And so we're at this point of huge challenge, I think, but also at a time when, and I say this guardedly, I think we are in a period, a golden era of science. And of course, we saw some of that in COVID with genomic surveillance, the sharing of information, the coming of therapies and vaccinations, built up after decades of investment in discovery science, but which came to the fore in the last 3 years. And the question is, can we maximize the benefit of that science to the maximum number of people? And can we ensure that evidence-based informs policy decision, but also appreciating that policy decision-making is an incredibly complex issue? And certainly, having only been exposed to it a little bit over the last few years and the last 100 days, I take my hat off to everybody that is involved in that professional activity of policy making at the interface between science and evidence. The other thing I'd say is that this is not something that you can just start in a crisis. I think that the interaction between scientists and policymakers and people that can bridge both of those communities are just so important in this world where science is progressing so fast, and it's hard for the diplomatic and policy communities to keep up with the science. It's difficult enough as a scientist to keep up with your own field, let alone the broad range of science that's now available. And people who can understand enough of the science or steeped in the science, but can also translate that in ways that policymakers can understand and then can act upon, whilst appreciating the complexity of policymaking, I think is a rare skill and something we should applaud and something we should encourage people from a scientific community and also from a policy world to engage with each other all of the time, not just in times of crisis. Finally, coming on to the role of the World Health Organization here, I think in my first 100 days, in a huge discussion internally and externally about what are some of the areas that we're going to focus on within the science team at the WHO. And we've chosen to focus on 3 areas, of which this is one: science, research, innovation, and policy, because I think that is just a core mandate of WHO to try and bring these communities together, member states, country offices, partners externally. Not for WHO to do everything. I think WHO is at its best when it convenes generously, it brings experts and partners together from the external world and provides a forum where those debates can be had and then tries to nudge things forward. And that is one of the 3 areas that we're going to focus on over the course of the next 2 or 3 months within the science team at the World Health Organization. And I hope sincerely that everybody on this call and more will play an active and engaged role in that. So in the spirit of partnership, in the spirits of saying that there is no one model where science, policy and politics mixes perfectly, but there's a lot of lessons to be learned. And it's delighted to be able to open and host this first session. And I'll hand back to our moderator now, and then introductions to Patrick and to Slim. And again, thank you all very much for joining. And I hope this will certainly not be the last of these summits. Thank you.
Thank you very much, Jeremy. Congratulations on your 100th day. So I hope you're looking forward to contributing a bit more in this space. So we're really excited to have you. I think our next speaker is Patrick Valance to talk to us about the framing of evidence to policy interface. And Patrick is a distinguished British scientist and physician who has an exceptional career that spans academic, industry, and government. And as a former chief scientific advisor to the UK government, I think he has a lot to contribute to this discussion. And I think I want to keep his bio a bit short to give me more time to share with us. Over to you, Patrick.
Thank you so much. It's such a pleasure to be part of this meeting. And I don't think there could be a more important time to think about this question of evidence to policy. I challenge you to think of a single area of government that wouldn't be improved by better evidence for science and technology in every single department. And of course, even if you just think about that from a health perspective, It's true across not just the health department, but the agriculture, Ministry of Food department. It's true across how we think about our housing. It's true as we think about the way in which we educate and the way in which we think about communication. So science, technology, evidence is crucial to every part of what government does and relevant to every part of how we think about health. It's also timely because there is a growth of misinformation, and that's going to become progressively more important across the world. But even if you put misinformation to one side, the sheer complexity and pace at which science is moving means that governments and ministers and policymakers cannot keep up with it. And therefore, there is a need for a professional evidence system to help that happen. I was the government chief scientific advisor in the UK for 5 years, and I was asked to say a bit about the UK system and some of the things that might be relevant to the topic of this meeting. So in the UK, there is a chief scientific advisor in every department. And there is a person in every department for the reasons I've just stated, that every single department requires evidence on science, technology, and engineering. We appoint those people from outside government. And the reason they're appointed from outside government is because it's crucial that the evidence generator carries a degree of independence. And that independence is easier if you're not in government for a long-term career, but you're in it for a fixed period, bringing an ability to be able to speak truth and not worry about career progression. The advisors need to be connected to each other because problems don't sit in one department or one area of science. But they also need to be connected to the outside world. And one of the really important things we found was the connectiveness of a chief scientific advisor to other scientists, both in the country and around the world, is important. And certainly during COVID, I found the connection to chief scientific advisors in other countries to be really, really important, whether that was to share factual information or on occasions just to hear how people were dealing with the complexity of dealing with political masters during a period of intense scrutiny. The third thing to say about the chief scientific advisors and why advisors are important is they need to be embedded in a team. So if an advisor is simply on his or her own, they can only respond to things that they know about and hear about. If they're embedded in the system and they are listening to policy discussions and listening to how people are struggling with certain operational or other matters, then they can bring that science advice even when the policymaker or the politician doesn't know they need science advice. So the chief scientific advisors need to be embedded in the system, and they need to have a team around them so that they're not just acting as a lone operator. There needs to be a system to support this. And the final general point to make is that they need to be trusted. Now, that may be obvious. Of course, they need to be trusted. But the reason I raise that is very often people get the idea that you can be a campaigner as a science advisor. If you are a campaigner, you will lose trust because politicians will say, well, of course you would say that because you're campaigning on a particular area. So campaigning can take place outside government, but as an advisor to government, I think it's important not to campaign. It's important to provide evidence, not opinion. That builds trust. It's important to provide scientific advice, not policy prescription. And I'll give you a specific example there. During COVID, the science advice, for example, on where spread of COVID was taking place was clear that it was much more likely to occur indoors where there was poor ventilation and there were multiple people in a single room. That's science advice. The policy implications of that, which buildings you choose not to open, which restraints you put on people mixing, those are policy choices that science can only advise on and shouldn't be the one making the decisions. And the final general point to make about the UK system and trust as well is make the advice public. So if you're evidence-based, you're giving advice, not policy, and you're making it public, you then make this easier for everyone else to contribute to and for policymakers to actually then articulate why a policy might differ from particular science advice. And one of the observations that I made during COVID, and I'm sure it was true in other countries as well, is the louder the voices in the community, in general, the lower the evidence base. So whenever you hear people shouting loudly about things, the chances are the evidence base is not as robust as it should be. So what are the 4 questions that the science advisor should ask him or herself? These are my views. People will have other views, but I've got a 4-question paradigm, which I think is helpful. The first is the evidence base adequate? And if it's not, what can you do about it? And I use the word adequate advisedly because the evidence base is never going to be perfect or as complete as you'd like it to be, but is it adequate to be able to give advice? And if it's not, what do you need to do to make that adequate? And of course, usually that means more evidence synthesis rather than evidence generation, but sometimes you may also need to generate evidence as well. The second question that the science advisor should ask themselves is, has the evidence been understood by the policymaker or decision maker? And this is important because very often you see people giving science advice and then saying, I've done my job, I've given it. It's important to go back and ask, has it been understood? And how do you know it's been understood? And by being understood, that means, does all the things that we as scientists often understand, have they really been understood? The uncertainty, the confidence or lack of it, the things that might change because new evidence comes along. Spending time to make sure that those things have been understood is important. The third is, has the evidence been framed in a way that's relevant to policymakers? This is, again, something that is often misunderstood. So to give a specific example from COVID again, a piece of evidence might be that there are a mutation rate of 10 to the minus 6 substitutions per nucleotide per replication cycle of the virus. That's scientifically true, but of course it's not framed in a way that policymakers can use. That needs to be turned into something that's relevant to policymakers, such as the mutation rate of the virus means that every few weeks you're going to pick up multiple new variants, many of which will have no consequence, but occasionally one will have a consequence. You need to be ready for that. And the final thing in the 4 principles is, can the science be used to monitor the impact of the policy? And this is a bit that's often forgotten. Policy is often put in place and never monitored, but science can be used to monitor whether you actually have had the effect that you think you've had, and if not, what you would do about it. So those are my 4 principles. Is the evidence base adequate? If not, what are you going to do about it? Has it been understood? And are you sure it's been understood? Has it been framed in a way that is relevant for policy? And can you monitor it using science and technology? I think if you ask yourselves those questions, the chances are you will be able to give good advice. My final closing comment would be on evidence synthesis again. Evidence synthesis is crucial. It's very seldom a single piece of original research that's relevant to policy making. Sometimes it is, but very, very rarely. It's much more likely to be evidence synthesis, and therefore having in your ability around the team, around academia, around contacts around the world, making sure that you've got access to relevant evidence synthesis which has been done properly. It's been done in a rigorous way with a methodology that takes into account the biases, that it's transparent as to how that evidence synthesis was put together and how different forms of evidence were rated. It's accessible so that everybody can see it and can understand where it's come from, and we're looking at the same evidence base. And it's inclusive in terms of the different disciplines that have made up the ability to bring together the evidence, because very often this is not just health researchers or biomedical people, it's engineers, it's others that come in to be important to give an overall inclusive and complete evidence base. So those are some of my observations, and I wish you every success in this meeting because I think it is incredibly important and incredibly timely. Thank you very much for giving me an opportunity to speak.
Thank you very much, Patrick. We appreciate your contribution and your insights to this event. And now I would like to invite our last keynote speaker, Professor Salim Abdul Karim. He works for CAPRISA. He's the director of CAPRISA in South Africa, and he's attached to a number of universities, and he has extensive experience. And I think if I go through his bio, it will be more than the time is assigned to him to share his insights for this meeting. Can I hand over to you, Professor Karim?
Thank you very much, Cecile. It's a great pleasure and indeed an honor to be here with you in today's discussion. I would like to use case studies to illustrate the value of science and how it can feed into the policy-making process. You heard very eloquently from Sir Patrick about some of the underlying principles that are really valuable in this process. But let me give you 3 case studies. The first case study I'm going to use is a clinical case study. And here at the, in the early part of the 2000s, one of the biggest causes of death in many countries in Africa was tuberculosis and HIV, and particularly when you had both infections concurrently. And there was a WHO consultation in 2005 that identified this challenge as a major priority for research. Well, we undertook such research, and that study that we did, a large randomized control trial of how to treat patients with TB and HIV co-infection, and we studied 3 different strategies, and the results of that study were published in 2 papers in the New England Journal of Medicine. But what is important was as soon as those results became available, they were included in a WHO rapid advice. This is when advice needs to be provided quickly because it can save lives. And what our study showed was that if you treated patients as we proposed, you could more than halve the number of deaths. And if you applied that to South Africa on its own, you would avert over 10,000 TB HIV deaths each year in South Africa. We worked with the government and the president to provide this as a new policy, and it was announced on World AIDS Day in 2009, about a few weeks after we released the results. And at that time, South Africa was recording about 69,000 deaths per year from tuberculosis. 5 years later, South Africa is now recording, was recording in 2015, about half as many deaths. And so what we found is that through impacting on policy and ensuring that we're providing rigorous evidence that can change clinical practice, and we did a lot of research about the cost effectiveness, about how clinicians can really implement this, it can lead to change and save lives. Second example I'd like to draw upon is one of the biggest challenges we face in the HIV pandemic in Africa. And here I'm sharing with you data from a study done in grade 9 and 10-year students, grade 9 and 10 students from several schools in rural South Africa. And here you can see the prevalence of HIV in young boys from age about 14 all the way through to the early 20s. The prevalence ranges from about 1 to 1.8%. Now, look at the situation in girls, drastically different. Already by age 15, about 1 in 40 girls has already become infected. By the time they reach their 20s, it's about 1 in 4 young girls are infected with HIV in these hyper-endemic communities. We were facing a major crisis. How do we change this? Well, we needed to understand it. Why is it that young girls are getting these high rates of infection? So we did a study using phylogenetics, a large community study. We sequenced thousands of HIV. The same team that pivoted to doing the sequencing for COVID that identified both the Beta and Omicron variants were involved with us in doing the study. And in doing this, we were able to identify the cycle of transmission, where women in their 30s were having sex with men in their 30s, were infecting them, and then these men in their 30s were having a liaison with a teenage girl and spreading the virus. And so that was creating this transmission that's sustaining high rates of infection. And this is the diagram from our article in The Lancet. Well, later that year, UNAIDS released this report, which was about the life cycle approach to HIV. And they took our diagram and they made it a much more easily understandable diagram. And that became the approach that the UNAIDS was now advocating about how to break the cycle of transmission in Africa. And indeed, from this policy document from UNAIDS, several countries in Africa have adopted it as among their high priorities. In South Africa, the National AIDS Control Program Strategic Plan lists the same very issue, breaking the cycle of transmission and the higher rates of HIV in young girls, exactly in the same way. They just took the UNAIDS diagram. They changed the colors, they called it infection pathway, they gave it a few different labels, and they basically took ownership of it, and it's now their plan, it's their diagram, it's their cycle of transmission that they are trying to break. And you see how the rigorous research can lead through a range of different mechanisms to policy in country. Let me end with the third of my case studies, and this was from the COVID-19 pandemic. So shortly after the first announcement of the Omicron variant was made by South African scientists, and we announced it, about 2 days later, I got an email from the editor of The Lancet saying, you hear everywhere on news sharing information about Omicron. We need to put something in the journal. The scientists need to know what's going on. And so we rapidly put together what data we had, limited as it was, and we showed, if you look at the red line, that Omicron was spreading far more rapidly than any of our previous waves. And we also showed that it was less severe and that it escaped immunity in subsequent studies. But all of this meant that we now had information that was valuable to other countries who needed to plan. And so we were invited to brief the US Congress, the all-party parliamentary group in the UK. So this information can then be spread because it's timely and it's valuable. So let me end off with the role of the WHO Science Council in the process of evidence to policy. The Science Council is a small group. We comprise 13 individuals from differing disciplines within health and medicine. And we come together and we meet roughly 3 to 4 times a year. And in our discussions, we focus on high priority science issues and how we might use science and technology to impact global health. And here I'm just sharing with you some pictures of the Science Council with the chief scientist, Soumya Swaminathan initially, and now with Jeremy Farrar. And one of the important outcomes from the Science Council was this report about making genomics accessible and impacting on global health. And in this, we provided a range of different kinds of advice that countries can use. And if you look at the report itself, we actually provide quite specific actions for each of the individual players, the WHO, member states, academia, industry, NGOs. We provide detailed guides so that anyone reading this can see how it relates to them and what are the courses of action that they can follow. So let me end off with, from my experiences, some valuable lessons. And you've already heard from Sir Patrick about the importance of how we provide advice, and we are providing advice, we're not making decisions, and it's quite important to draw that distinction. So the importance of timely, rigorous research. Without good research, you can't provide good advice, and you will never have perfect research. You have to make the best of what's available when you're providing advice, to ensure you deal with the caveats, to communicate that in the scientific community, try and build consensus with the scientific community, with the policy community, and in translating these findings, to keep the messages focused. Focus on the science, stick with the science, keep it simple, include what is known and what is not known, and the reliability or the lack of reliability of the evidence, and convey it in an agenda-free manner. Ours is not here to push a particular viewpoint or particular line of action. Ours is to provide the evidence and to enable everybody to own those findings so that they can use it the way in which they. So the timeliness of evidence in the policy-making process, understanding that process and how to fit into it, and ultimately what's really important is trust. When you are trusted, you have the ear of policymakers, it helps a lot. Thank you very much.
Thank you very much, Professor Salim, for enlightening us about the role of evidence to policy and the World Health Organization Science Council. That was really enlightening. Just to remind our participants, please use the chat to ask your questions, comments, or any key messages that you are drawing from these discussions. Please share with us so that we can, when we find time in between the sessions, we'll try and see how to get your questions answered. And also, please don't forget to join the EVIPNet LinkedIn group, also to continue conversations there, just to make sure that you are part of a discussion as it goes on. At this moment, I would like to invite Tanya, who is the unit head for evidence to policy and impact research for health department and science division at the World Health Organization, to present progress and steps taken so far towards implementation of EVIPNet call to action, which was launched at the previous event. So over to you, Tanya.
Thank you, Sisiva, for giving me the floor, and to our eminent keynote speakers for having set the scene so well for the day and the summit as such. We will have another additional keynote intervention later today, as Sisiva has pointed out, from the Honorable Minister of Health of Chile, Jimena Aguilera, who will be speaking about navigating the nexus of evidence and policy. In the next 15 minutes, my regional colleagues and I will take you on a short journey, highlighting, on the one hand, the EVIPNet call for action, which was launched at the last WHO Global Evidence to Policy Summit in November 2021, the call's interlinkages with Cochrane Convenes and the Global Commission on Evidence to Address Societal Challenges, as well as recent activities implementing the call for action since its launch. But before we do that, let me give a bit of a context on the WHO Evidence-Informed Policy Network, EVIPNet, the network which is at the core of the summit and of the call for action. Next slide, please. EVIPNet is, as many of you know, a global capacity building initiative on evidence-informed policy with the mandate to promote systematic and transparent use of evidence, so available data, research, and other forms of evidence in policymaking to improve health outcomes. It has the mandate to increase country capacity and knowledge translation by providing training, mentoring, coaching, as well as peer support. And beyond individual capacity building, the network also promotes the institutionalization of knowledge translation through the establishment of knowledge translation platforms, which functions as an evidence intermediary or advisory body. And EVIPNet is active in more than 50 countries globally. Next slide. To advance and promote the work of EVIPNet, a call for action was launched at the last Evidence to Policy Summit with 4 main strategic directions and 16 steps that together foster evidence-informed decision-making. So the first strategic direction is about the importance of creating and strengthening institutional structures and processes that can rapidly respond to decision-makers' needs while drawing upon contextualized evidence. And it also stresses the need for leadership and commitment to promote a culture for evidence use. The second strategic direction focuses on the development and use of norms, standards, and tools to ensure high-quality knowledge products are being developed and processes as well. Then capacity building is the focus of the third strategic direction. A critical mass of people should be trained. In addition, we need to move away from siloed approaches to integrate research, evidence, and expertise across evidence ecosystems. And we urgently need sustainable funding and incentives. And finally, the fourth strategic direction outlines the need to develop and provide global evidence goods, as well as comprehensive evidence repositories to easily access the evidence. Next slide. The evidence call for action aligns with and complements 2 other sets of recommendations developed by Cochrane Convenes and also the Evidence Commission. While all 3 initiatives apply slightly different approaches and perspectives, they have the same goal to strengthen evidence-informed decision-making. These three initiatives, therefore, have since the beginning of 2022 closely collaborated to create synergies. At the summit, this begins, or this is exemplified by a joint session that we're organizing tomorrow on engaging citizens. But let's have a look now at the implementation of the call for action through the last 1.5 or 1¾ years and look at progress made. So next slide. In terms of institutionalizing structures for evidence to policy, we and others have for a long time stressed the need for institutionalized evidence to policy mechanisms. And we've generally used the term institutionalization vaguely, meaning different things to different people, and didn't have any clear guidance to our member states how to proceed and routinely embed evidence in policy processes. This year, we published a new tool on institutionalization that has already gained much traction at member states level. We are now, with the seed funding from the Geneva Science Policy Interface, pilot testing the tool in a few countries to understand its applicability and user-friendliness. And we will hear more about evidence to policy institutionalization in one of our summit panels led by our colleagues from the Eastern Mediterranean region. Next slide. When it comes to the development and use of high quality norms, standards and tools for evidence to policy, the last 1.5 years have been busy. At headquarters, in collaboration with the regions, we have developed a WHO guide for evidence-informed decision-making with the objective to guide and support member states in optimizing the use of evidence, and also to establish closer collaboration across the different evidence ecosystem work streams. The guide has become a key normative reference on the evidence policy nexus. It comprises a textbook on evidence-informed decision-making and the evidence ecosystem framework for impact, an evidence-informed decision-making toolbox supporting operationalization, and also an online repository of WHO evidence-informed decision-making tools. The guide has also been adapted by PAHO and contextualized to the regional needs, including a focus on emergency situations. Next slide. In addition to the WHO evidence-informed decision-making guide, we have been active in the last 1.5 years in closing some other normative gaps. As you can see on this slide, we have created this one-stop shop related to the guide that I've just mentioned, outlining all the existing WHO evidence-informed decision-making tools. And in addition, a training package was put together by our colleagues in the Eastern Mediterranean region. Next, one click, please. A new focus has been put on citizens' engagement in evidence-informed decision-making and giving voice to the public in view of strengthening inclusive mechanisms to enhance trust in science and public institutions. Next. We have also worked on adoption and adaptation of guidelines by our colleagues in the European and the Americas. They have developed these other two tools, these guidance that you see on this slide now. Next. Additional guidance on evidence synthesis with an eye on rapid mechanisms were developed, a lesson learned from COVID-19 that we need to have even quicker means of mobilizing the best available evidence in crisis situations. And this is complemented by our newly initiated work. Next. As you can see on this slide here, the second bullet point, WHO plans to more systematically put in place internal procedures for living evidence synthesis. And for these, policy uptake mechanisms need to be equally enhanced, which our group is looking into. We are also furthermore developing a new guidance on implementation, sustaining and scaling up, a piece of work that we have just initiated with other colleagues in-house working on delivery for impact and also product design and impact in collaboration with the University of Newcastle in Australia. And with this additional tool, we will be able now to support member states really along the policy action cycle from prior to setting to policy formulation to implementation and impact. Next. In terms of capacity building, since the last summit, we have been supporting EVIPNet members by organizing in total 72 training sessions, including face-to-face, online trainings and webinars with 52 countries or 54 countries and close to 11,000 individuals that have participated in our activities. In addition, coaching sessions were organized for network members to advance their skills in certain areas such as evidence-based for policy development, engagement, or research communication. And in terms of outputs, 18 knowledge products were developed since the last summit with the direct support from network members, from the network secretariat. The network members as such, so the network as a whole, including very experienced EVIPNet members, has developed a considerably higher number of outputs, which have not been captured on this slide. Next. Finally, regarding the provision of access to relevant and timely evidence, several health evidence network reports were developed. So these network reports are policymaker-oriented evidence synthesis. They were developed by the WHO European region. Next. And in addition, as you see here on the slide, the WHO region for the Americas has been very active in providing access to evidence with the establishment and regular updating of various databases. So, for example, the database BIG, the International Database of Great Guidelines, the BIG REC database, which has more than 3,000 WHO and PAHO evidence-informed recommendations, the SDG3 monitoring, analysis, and evidence dashboard, just as EVIT-Easy, which provides access to guided search strategies. Next. So having provided a snapshot of the developments of global and regional levels, we thought to also give brief insights on the country progress and implementing the call for action. So Manas, can I give you the floor first for an example of the WHO Eastern Mediterranean region? And just to introduce Manas, Manas Karandish is Regional Advisor, Evidence and Data to Policy at the WHO Regional Office for the Eastern Mediterranean. So Manas, over to you.
Thank you, Tanya. Hi, good morning, good afternoon, good evening, everyone. So I just will explain one of the experience that we had in WHO recently. Since our resolution on development of national institutional capacity for using evidence for policy development in 2019, we actively supported countries in enhancing their national institutional capacity for evidence-informed policymaking, and this work has involved technical support for the establishment of national structures and processes, as well as building technical capacities, especially within ministries of health and key partner institutions. In 2022, last year, the Knowledge Management Center was established in Muhammad VI University in Morocco with the support of WHO to provide the Ministry of Health with the best available evidence for decision-making, particularly through local data and local evidence. The establishment process required national capacity building, thematic workshops, and the creation of a network of relevant institutions to support the Knowledge Management Center, and WHO facilitated development of the evidence products, knowledge products, such as policy briefs and scoping reviews by the network, addressing national high priority health problems in collaboration with Ministry of Health. Thank you, Tanya, over to you.
Thank you so much, Manas, for that intervention. And I will now provide an example of the WHO African region, as our regional advisor on health research, Joseph Okembuno, is held up at the WHO Regional Committee for Africa. But in terms of the second strategic direction in Uganda, the Ministry of Health has revised its governance management guidelines. These include new standardized processes that were developed through whole of society approaches. Launched in 2022, these new national guidelines represent a major milestone to embedding evidence use into the DNA of the Ministry of Health to ensure that all policies, standards, regulations, and also decisions are informed by the best available evidence, aligned with the values, norms, and also practices in Uganda. Efforts now are need to be mobilized to systematically apply these guidelines in the country. So this is a highly interesting area, the second strategic area of the call for action, where also in other countries a lot of activities are taking place. In Brazil, for example, the Knowledge Translation Unit at the Ministry of Health has matured into a robust knowledge translation platform that has just introduced a standardized portfolio of knowledge translation products, including a national guideline on how to develop evidence-based policy. So a space to be watched by us. I will now hand over to Marga Reinert, my counterpart in the WHO European region. Marga, over to you for an example of your region when it comes to capacity building, please.
In WHO European region, for capacity building, we have formed key partnerships with our technical teams, such as antimicrobial resistance, nutrition, mental health. The partnerships and working together address barriers in translating knowledge to action in these health topics, as well as pool resources. Through these collaborations, we have provided joint trainings, mentoring, and follow-up support to several country teams using knowledge translation tools like evidence-free spur policy and policy dialogue alongside technical content. This approach not only yields contextual and evidence-informed policy guidance on those priority health issues, but it also results in improved understanding, strengthened skills, and demonstrated value of evidence-informed decision-making in these countries. One example being the collaboration with our cancer team to support the development of National Action Plan on Childhood Cancer in Uzbekistan. There are many more examples, but just highlighting this one.
Excellent. Thanks so much, Marga. And now I'd like to pass the floor on to Ludovic Reveis, WHO Regional Advisor, Health Research Management and Evidence in PAHO. Ludovic, over to you, please.
Thank you, Tanya, and hi, everyone. I want to share a case of institutionalization at the country level. Several countries in the Americas, including El Salvador, have made significant progress in establishing evidence support system for decision-making. The National Institute of Health in El Salvador embarked on a transformative journey in 2018 to strengthen health policy and practice using evidence. They improved program governance, modernized guideline procedures to the grade system, and utilized the PAHO and WHO resources as well. Over 100 professionals were trained to develop great guidelines in line with global standards. This collaboration yielded over 10 meticulous craft guidelines advancing healthcare in communicable and non-communicable diseases, maternal and child health, among other areas. El Salvador government played a key role providing policy, financial, and technical support to institutionalize the evidence, guideline, and policy program. Thank you, Tanya.
Thanks a lot, Ludovic, also for you for your presentation of the developments in PAHO with regard to the last strategic direction. So we have two final slides. If I could ask for the next one, please. Based on a quick survey that we undertook prior to the summit with our network members, we identified the following 5 priority challenges that countries have faced in the implementation of the call for action. So firstly, legal frameworks to enforce the use of evidence and policy are often still absent, just as mechanisms coordinating and facilitating the alignment between evidence and policy. While during the pandemic, the spotlight was put on evidence and its use, there is still a relatively low level of awareness and commitment to use evidence among policymakers. In other words, a culture for and leadership in evidence to policy is frequently still in its infancy. Overall, human and financial resources, capacities, and incentives for knowledge translation remain weak. And finally, the lacking access to relevant, good quality and contextualized evidence continues to be an issue. So these 5 points in many ways reinforce the need to scale up the implementation of the call for action as they are directly linked with the court's strategic directions. Next slide. In terms of lessons learned, as just mentioned in relation to the previous slide, the challenges listed have confirmed the relevance of the call for action for our network member countries. Secondly, given the complexity of institutional capacity building, tailored and adaptable modules for bottom-up capacity building and institutionalizations are needed. And these processes, we need to keep in mind, are not only complex, but they are also time-intense and resource-intense. Thirdly, we need to strengthen our work across sectors and create integrated systems. We hear more about this area in a session tomorrow led by the WHO European region. And there is much learning to be done, including how to bring different kinds of evidence in a meaningful way together for decision-making. This includes tacit knowledge of citizens, as well as policy foresight and artificial intelligence, all topics to be explored, including in dedicated sessions at the summit. Fourthly, we need steps and scaling up of efforts in building global collaborations to coordinate efforts. While with EVIPNet, we have been successfully working across the 3 levels of the organization. We have been requested at the last summit to launch a global multi-sectoral coalition of partners across the evidence ecosystem to create additional synergies. And based on our experience throughout the last 1.5 years, such a coalition still seems highly relevant. So we hope that with this presentation, we have been able to provide some insights into the progress made when it comes to the implementation of the call for action. We greatly look forward to the deliberations and learning at the summit with you, and also to your contribution to this session with your experiences, comments, and insights. And with that, I'd like to hand back to Cecilia, please.
Thank you very much, Tanya and team. It's really important to look back and sort of see what are the lessons that have been learned throughout the process of doing this. Thank you to your team as well, really for presenting the progress towards the EVIPNet call for action. It has been an interesting to hear about the advancement that have been made at global, regional, and country level, and the challenges encountered that would need to be addressed as the next step. And I would like now to ask participants to reply to 2 polls about the topic so that we can get more insights in terms of this particular topic, and also post in the chat what initiatives you have been engaged in with in advancing the 4 streams of the call to action. So please respond to the polls on the chat. We have 2 polls. The first one, the question is, which key actions from the call for actions are or your organization mostly engaged in? And then the second poll will talk to which key actions from the call for action do your organization need support to explore a bit more. And I think that will really be great to get your inputs, your comments on the chat. Just also to say, there are some people that have their hands raised for questions and answer. Please put them down and just put your questions in the chat as well, and then we'll address them as we go along in terms of the discussions that we are having today. Let's do the polls. As we do the polls, I'll sort of pull in some of the things that are coming through as you do in the poll. Continue to comment on the poll, just to make sure that we record your inputs. It will really be great to hear from you. We are so excited to hear from you. Let's keep going. We're a few minutes before the poll closes. Okay, I think with 5 minutes left to this session, I think let's just turn into some of the comments and your experiences in catalyzing the use of evidence in implementing the call for action. I think there are some comments that are coming in that are very interesting. The experiences from the Republic of Moldova since the last summit, they were able to contribute in the sort of the COVID crisis to underpin most important and timely and reliable evidence in the health policy aspects discussed within WHO, the last session. And then I think also as EVIPNet Europe, they have already experienced changes in law, particularly on alcohol control, by developing a policy brief. So there's some of the interesting things that are happening. They've also had an opportunity to organize a policy dialogue in 2022 to make sure that they're able to contribute to their country. And then there are a few examples as well that I'm seeing from Brazil. I can see that sort of people focused on some of the systems issues around, governance excesses, just to make sure that they have strengthened their governance structures, and make sure that they have consolidated some of their rapid review services with a production of more than 200 evidence synthesis for policy in the last 4 years. And some have sort of worked in sort of fostering projects, promoting of initiatives to improve management of data within the Ministry of Health in their country. So really things are happening for the call of action. People really took it really seriously. And then also another example from Brazil around culture of evidence. In their routine, sort of they have monthly meetings with managers to present research results using structured policy dialogue. And they're trying as much as possible to have a standardized tool to achieve more reliable results as well. And they invite researchers, health professionals to be part of these discussions. So that at least the more people know about the work that they are doing, the better it is looked at. And I think also, the Brazil team are really excited. They went out there to make changes. I think one of them also are saying over the past 2 years, the general coordination of evidence in health, particularly in the Department of Science and Technology in their Ministry of Health, has tirelessly improved and advanced in terms of how they're doing their work. And then Executive Secretary, it was also defined that management and governance were a priority. And then during this period as well, internal activities were carried out, such as network diagnosis. They developed their action plan, mapping of those that are interested in institutionalizing some of this work. So I think there's a lot coming up. So I'm sure when the report is prepared, people will see a bit more of these examples, see more of the stories that are coming in from the last summit, where people were called to act and make a difference at regional level and country level. So it's really exciting to see the energy that people have in terms of making sure that they contribute to their countries in terms of this particular work. So I can see that we are looking at still coming, those comments are still coming in. But at the moment, we're ready for the next session. So I would like to say thank you to all those that contributed in sharing their experiences in advancing the call for action. Let's see how throughout this deliberation over the next few days, further solutions can be identified and global commitment can be solicited, just to make sure that we are able to get global support and support each other and build this network a bit more. So it's really exciting. I'm very excited for the team that has organized this event. Thank you very much. On to our next speaker. So I think the poll was aimed to relax you a bit, to share some of the exciting work that you are doing. I think the next session is on. We have Dr. Lawrence Mahlanga Langa, who's going to present for us on the project that they have worked on in his organization. He's a representative of the South African Center for Evidence in South Africa, and he's going to present their findings on evidence mapping and what works in supporting the use of evidence and developing global knowledge transition research agenda. So over to you, Lawrence.
Great. Thank you so much, Ziziwe. Hello, everybody. I'm going to give you a very quick 10-minute pitch to the preliminary results of our mapping exercise of what works in supporting the use of evidence and how we can use these results to develop a global knowledge translation research agenda. I think while the slides are still coming up, just to say this is work funded by the WHO and done in very close collaboration with the team at the WHO. Next slide, please. So the motivation from this work comes actually from a slightly awkward confession to make, which is that as advocates for evidence-informed policymaking, EIPM, we might be great at telling other organizations and decision makers to use evidence and to make sure they evaluate their programs and use those results to inform the next program. But are we actually as good as using evidence ourselves? So when we are designing interventions to increase the use of evidence, are we as advocates for EIPM, are we using evidence ourselves? And to put spotlight on us here in South Africa, we have quite a few initiatives around partnerships, communities of practice and networks to increase the use of evidence. But to be really honest, we haven't always used the best available evidence when we designed these networks and partnerships, and we don't necessarily always evaluate them and use the results to see if they actually make a difference. So it's slightly tricky, right? Because we're telling others to use evidence, doctors, education specialists, the decision makers, but are we really using evidence ourselves to the extent that we could? Next slide, please. So what we thought as a starting point to kind of help us with this dilemma is to start mapping the evidence out there on interventions to increase the use of evidence. So we took an approach inspired by VRE on evidence gap mapping, but broadened it a little bit. So our map included a broader types of evidence than in usual conventional evidence gap maps. We searched really widely, and not just the academic grade literature, so not just the academic literature, but also grey literature and many other sources. And we searched in all UN languages. A key point to mention here is that we kind of see the use of evidence as being both an art and a science. So the art being like, how do we navigate the politics, the context, the tacit knowledge, and how do we create a space for evidence in that? Whereas the science is on the slightly more repeatable interventions like capacity building that we can approach in a more linear fashion. So the evidence map includes both these bodies of knowledge. Next slide, please. So we'll play a video in a second. Hold on just for a second. We'll play a video in a second that gives you an insights in how the tool actually works in practice so that you can see it live. But just as a heads up, so we found a large body of evidence, over 67,000 citations, and we had 617 studies included in the end. A key point here is really that it's the preliminary. So we're looking forward to your inputs, and we'll show you a little bit more in the video of how you can input. But please, if you know of evidence and data that we might have missed, please share these with us, and we'll make sure to see if it fits the map and its scope. With that, kind of some key high-level findings to keep in mind. The evidence base is dominated by the health sector, but we do see a fairly decent split between the science and the art of evidence use. Over into the video. I'm not sure if we have sound, but else I can do the narration live. So tech support, do stop me if I shouldn't do that. But yeah, on the screen, what you can see is the matrix for the evidence map. It has a usual structure with interventions to outcomes. On the left, we have the interventions for evidence use, which are structured in 6 mechanisms of evidence use that I had just in the pre-recorded video scrolled through. But yeah, so essentially we have 6 mechanisms for evidence use that structure the evidence base from an intervention point of view. Those were the awareness for evidence, agreement on evidence, access to evidence, relationships between decision makers and researchers, capacity building, as well as institutionalization, which we express as structures and process for EIDM. On the top, we have the outcomes of evidence use. I think colleagues from tech support, if you might want to restart the video at this point. So on the top, we have the outcomes for evidence use, starting with the intermediate outcomes of implementation fidelity for these interventions, as well as design considerations. Then we're going into the capability to use evidence, the opportunity to use evidence, and the motivation to use evidence as behavior change outcomes of evidence use. And then on the far right, we have the more final outcomes of evidence use for policy design, implementation, and development impact. I do think at the moment the video unfortunately is static, so I will just speak to it a little bit more, as you can see on the screen. So the patterns on the evidence base, the visual patterns show you quite clearly where we see more evidence in different configurations between intervention and outcomes. So you might have guessed that the larger the bubble, the larger the evidence base, and the smaller the bubble, the smaller. So there's a clear visual pattern where we're seeing the evidence drop off the further we go to the right-hand side. So the closer we get to the final outcomes of evidence use and development impact, the less evidence we have available. If we were able to scroll up and down, you'd also see that on the mechanisms of awareness building for EIDM and advocacy for EIDM, we have little evidence. And we also have little evidence on getting to agreement between a good fit between policy needs and evidence needs. So that's some of the key findings. We see a large body of evidence there, particularly on capacity building, which is currently right on the screen. And you can see how the bodies of knowledge differ. So on the capacity building, we have a lot of information on the science of using evidence, whereas on institutionalization, we have more evidence on the art of using evidence. A few other items that the video would have shown you is that you can filter for different contextualizations. So if you wanted to know just the evidence base for your particular region, you're able to do so. Different study designs, you can filter for these. On the View Records tab, you would have seen all the 617 studies that are currently included in the map. If you just wanted to have an exhaustive list, essentially. And then I guess the key functionality, which is if you would click on submit a study, a little pop-up will open, and then you will be able to get instructions on how can you feed your evidence and your data into this evidence lab, which is really a key point to say that we really encourage you to please do share your evidence. We had a call out, we did search widely, but there's always something that we might have missed and we would love to include it. I think this hopefully is given, despite the slide static video, my apologies for that, has given you an introduction of the tool itself and how the map looks like. So let's see if we can move over to the next slide. I wonder, would we be able to move to the next slide by any chance? Not on the video itself. Fantastic, thanks so much. So just in the interest of time, so I'm going to have to be a bit brief on these, but so what does this map help us to do in terms of going forward towards the WHO Global Research Agenda? So we really only scratched the surface on the findings, so there's much more to talk about, and we're looking forward to engaging further. But one of the key results is really that just this exercise of mapping the evidence and taking stock is probably really helpful as a routine procedure for any evidence advocate. So practicing what we preach, we might want to be systematic about always having the best available evidence at hand when we design our own intervention. Doesn't have to be an evidence map, of course, but some form of integration between the evidence on what works to increase evidence use and our interventions to increase evidence use is probably beneficial. The second one, and I think that echoes what we heard earlier in the keynote, is there's a large synthesis gap. As much as we have found quite a large body of primary research and some systematic reviews, overall there's a large gap on the synthesis side. The third one, and I think again this is slightly tricky for us to communicate, is that if we say evidence use and evidence-informed policies lead to better outcomes, like better lives, better health outcomes, education, well-being, and so forth, at the moment, our interventions, as well as the evaluations of these interventions in the EIPM space, don't really target that. And so it's in a sense, it's an absence of evidence because it's not often being tried. So there's very little empirical data that we can draw on to kind of substantiate this last pathway from, if we have evidence-informed policies, are they actually more effective than non-evidence-informed policies to increase development impact? And so we do need more research and empirical data here. The fourth one is around a lack of shared conceptual frameworks and taxonomies of interventions and outcomes, as well as indicators of evidence use across the field, which makes it really tricky to cross-learn from each other and see a diffusion of innovation. So, for example, I know of colleagues in Kenya who do amazing work on evidence use and have amazing interventions in place, but it's hard to understand how that work fits in with my work in South Africa, because we often use different language to describe different interventions and have different outcome indicators. And then the last one, which I think is one of the key findings here, is that yes, we did find a large evidence base, but we also did find large knowledge gaps remaining. And that kind of shows you that we do need a bit more coordination on the research commissioning and research production side in the EIPM field. And I think particularly thinking who could do that at a global scale, there's probably only a few trusted coordinating bodies out there, with the WHO being one who could drive such a global research agenda process. Thank you very much, and back to you, Chair.
Thank you very much, Lawrence, for sharing your presentation about the evidence map and the global knowledge translation agenda. This session is significant to the policymaker because it provides a systematic overview of the available evidence on particular policy issues, which can help them to make informed decision-making. So thank you very much for sharing in this meeting. Thank you so much. I think this morning we had amazing individual speakers that were speaking to us. Please don't forget to use the chat. Share with us your thoughts. Share with us any key messages that you drew from the speakers that spoke earlier this morning. Any questions that you have, please use the chat just to make sure that we know what you need and what you need more information on. That will really be great. Just to say now to our distinguished participants of the WHO Global Evidence to Policy Summit 2023, now I would like to invite you to join us for our first panel discussion on funding and evidence policy initiatives, priorities for now and the future. We are excited to have 6 important funders joining this particular panel, and this panel will discuss how innovative technology, funding priorities, and competing policy initiatives are reshaping the landscape of our evidence to policy intervention now and in the future. Please remember to use the Q&A feature to submit your questions during the session, and the session will focus on eliciting funders' perspectives and priorities within the evidence to policy field. And for this panel, our moderator will be Dr. Jeremy Farr, who is the WHO Chief Scientist, and I would like to invite Jeremy to introduce all our panelists as the moderator of this session. Over to you, Jeremy.
Thanks very much. And it's me again, I'm afraid. But we're exactly on time, thanks to our brilliant chair. Thank you very, very much, and the panels before. Some unfortunate news. We were going to have 6, but actually Henrika Hartmann was not well today, so we wish her very best recovery, and we're sorry that cannot join, but we will certainly be engaging with Henrika and the Volkswagen Foundation in the future. But a very warm welcome to 5 panelists. We've got about an hour for this session. We've got what's described as round 1 and round 2. Between round 1 and round 2, I'm going to insist that everybody stands up, does a dance, does some stretching and whatever you want to do. You can turn your cameras off if you want, but just so that we keep energy levels wherever we are, in whatever time zone you are in the world. I will introduce very quickly. I put your organization links into the chat bar, so I think everybody, but do feel free just to give a short background as well to your own organizations. So in no particular order, but everybody is now on the screen. Montassa Kamal, Director of Global Health at the International Development Research Center in Canada. Christopher Chibanwa, Program Officer, Gender Equity and Governance at the William and Flora Hewlett Foundation. Angela Bedinak, the project director at the Pew Charitable Trust, but the lead on Transforming Evidence Funders Network. Beth Thompson, Chief Strategy Officer at Wellcome, and Hannah Schermatz, the Head of Policy at Filia Organization. As I say, please do feel free to say a little line on your own organizations and what you're doing. A very warm welcome. So it's great to be a moderator and not to be on your side of the table every so often. The first question, which goes to everybody, and please do feel free. You've got 2 or 3 minutes, but we've got time, so take your time. What I'm interested in is, what are the top 2 or 3 priorities for you and your institution? We're keen to hear on where you want to push your institution, as well as your institutional sound bites, both now and in the future. You've heard the interest, you've seen the polls, you're all steeped in this area. What would you like to do to change the world in this space in the next year? What would you like to change the world in the next 5 years or so? And Montassa Kamal, I'm going to start with you from Canada, if I may, and then I will come to Christopher and then Angela.
Thanks very much, Jeremy, and thanks very much for WHO for this great start for the summit. We've been long-term supporters of EVIPNet, and it's really a pleasure to see this event happening again. IDRC, International Development Research Center, is a part of the Canada International Assistance family. With our mandate, unique mandate, is supporting research in developing countries and low and middle income countries. So with this mandate, we really have our work cut for ourselves and for our grantees and partners to fund research that is focused on not only how the research is, or the issues that the research is studying, but also how the research evidence or the findings are used, either for decision making in terms of policy change, but also in terms of change of practice, change of behavior, or even developing new products or development or innovation. So it's really, the use is very much embedded in our mandate and in what we support and aim to support. This is, of course, easier said than done, as many of the previous speakers pointed out. So maybe I'll just mention 3 of the gaps that we are currently really pretty preoccupied with. And I'm not talking about sectoral gaps. We have, development, we have global health, education, inclusive economies. So these are sectoral gaps that we're interested in. But in terms of the evidence to policy gaps themselves, we have 3 that I'm going to focus on right now very quickly. One is, we feel there is really a first gap is we really feel there is a great need for questions around gender and social inclusion in the production and study of the production and use of knowledge. Oftentimes, the focus is kind of on abstract use of evidence to policy, but there are many dynamics that go into gender dynamics, social power dynamics that go into the production and use of knowledge. And these need to be studied and understood if we're really serious about the use of evidence. So this is one gap we're very, very interested and passionate about. The second area is really we have our work cut for ourselves to really understand the science of research co-production. Kind of the old model of donors deciding what are the research gaps, so putting out calls, whoever is interested or available applies. This old model still exists, and there's maybe some use for it, but this old model is really has proven that it has run its course, and we need to understand how we can do better in terms of supporting the co-production, the decolonization of knowledge, the production of knowledge, and how to really build and incentivize effective partnerships for sustainable outcomes. The third gap is related to, and this is maybe part of one of the many wonderful partnerships we have with other colleagues and donor organizations, but this one with Hewlett Foundation, and Chris is here. Where we're really we're we're challenged as donors, and in the case of IDRC maybe specifically, by the timelines we have. Development is a long course. Policy change is a long haul process. But we always have time limits on how we're, when our funding is available, how, by when it should be expended. And then, and also when it ends, usually it's very difficult for example, for our partners or donors to, with grantees, to, when an opportunity arises, to use that evidence, maybe with a little bit of investment of money for, policy uptake or translation or visualization, for example. Once the funding for certain projects has ended, this becomes very challenging. They are very mechanical and tedious administrative issues, but they are really part and parcel of how we can change our model, improve our model, to become more effectively, to have a more effective support for policy uptake and policy translation and evidence uptake. I'll stop here with those three gaps, but hopefully we'll have a chance during the rest of the panel to come back to some of them.
Thanks very much, Natasha. We will come back. But can I go straight to Christopher? I hope everyone doesn't mind if I given names. Christopher?
Yeah, sure.
Three more minutes.
Thanks so much, Jeremy. And thanks to the WHO for having us. I think building on what Montasa has said, there's definitely a few things that I think we as the Hewlett Foundation see that I'd say are broken around the evidence to policy and access. And I think the first one that I'll highlight from a funding perspective is the fact that a lot of funders that support evidence to policy work, basically I would say take a consorting approach to ecosystem strengthening. So we all acknowledge that we need a strong ecosystem. We need strong organizations that either produce, broker, translate knowledge. But strengthening those institutions, building those institutions is hard work. It takes a lot of time. It takes a lot of patience. It takes a lot of money. And I think, as Montes just mentioned, that we don't usually have the natural patience as funders to actually wait that long before we can justify the funding that we provide. And so I think how this is manifested is that we see these caps on overheads that as funders we impose on organizations whenever they apply for funding. But see, the overheads, the indirect costs, that's the money that those organizations need to invest in the things that enable the highest performing organizations to make incredible breakthroughs, things like technology, talent development, staff retention, internal measurement, internal M&E, as well as fundraising. Just to name a few things that would be covered. But we have 15% caps, others as low as 10% caps, which are barely enough to cover those essential costs. And I think there's an assumption that an organization that has minimal administrative costs is more effective. And so it sort of changes the incentives for donors that we want to work with, seek out those organizations that have as low indirect cost as possible. But here's the issue. We can't separate a program from the people that run that program, the people that deliver that program. And so to ensure that a program can actually achieve maximum impact, we must actively invest in those organizations that we're using to deliver the programs. And so instead of engaging organizations, evidence organizations as consultants, essentially buying specific services from them without investing in the long-term sustainability of those organizations, which ultimately then impacts the sustainability of our own investments. If those organizations are not strong, then our work with them will not continue beyond those project cycles. Now, the Hewlett Foundation is working to change this, at least internally, by, among other things, providing as much flexible support as we can to our grantees, allowing them to invest in the things that are essential for their growth as organizations, and allowing them to respond flexibly to opportunities, policy opportunities as they come up. We also have a dedicated grants portfolio within the foundation that's devoted to improving the effectiveness of organizations. We call it organizational effectiveness support, because we believe supporting our partners this way gives them the agency to decide what areas are essential to strengthen their existence. And I think an additional area here is that it's always been the Hewlett Foundation's philosophy to fund the true costs of projects. And I think the E2P, the evidence to policy field, would benefit greatly if funders had honest conversations, committed to having honest conversations with their grantees about what it truly costs to deliver impact. And that might include getting rid of those arbitrary caps on non-indirect costs. I think the second gap that we often see as a funder, and acknowledging that it's a very privileged position to be a funder of evidence generation, evidence use, evidence to policy work. I think what we've seen over the past few decades of funding evidence to policy partnerships is that we've created and sustained particularly large evidence organizations that have significant power, both at global as well as at national levels. And today it's very easy for funders to identify these organizations. They're almost in, I'd say, every funder's grantee portfolio. I think IDRC and us fund the same organizations. And I think we need to question what this approach means in the context of power and equity. And regarding equity, I think it's important to acknowledge the funding gap between emerging evidence organizations and mainstream large established evidence organizations who, at this point, and thanks to our support, have the privilege of having established strong fundraising departments. And then when it comes to power, the individuals and institutions who generate, who own, who translate, and have the knowledge and capacity to use evidence have the power to shape narratives, to influence policies, and to determine how resources are allocated in governments. In our work at the Hewlett Foundation, we've seen many forms of imbalances, power imbalances in the evidence ecosystem that manifest in so many ways between Western evidence organizations and their global South peers, between national and local governments, between marginalized communities and elites, individuals and their states. And in either case, we're committed to working with our grantees to identify and reduce these power imbalances that may be present in their work so that policymakers have access, and policymakers, evidence institutions, and others have access to the evidence that's needed. And I think one way that we're doing that is trying to diversify the types of organizations that we fund, that it's not just the same go-to players, that if we're talking about localization, for instance, it's not just about transferring, I think, what the setup is at the global level to creating elites in a country like Kenya or creating elites in a country like Ghana, that we're diversifying and having as many voices represented as possible within our portfolio. And then the final thing that I think I observe as a gap is related to what Montesa said, sort of the science of informing decisions, policy decisions. I think for a long time, I think we've assumed that if we build it, they will come. If we provide the evidence, that policymakers will use it. And that hasn't worked because policymaking is a very political process, and there are underlying incentives that policymakers have. We don't really know as much, I think, as a field, what works to begin to alter those incentives, to intrinsically create cultures of evidence use within governments. And I think there's potentially a role for citizens to be engaged. And it's been very encouraging to see that this particular webinar, this session actually includes a discussion around the role that citizens can play enforcing evidence use by their governments, demanding accountability, encouraging their governments to use data and evidence. Perhaps there's a role for the media as well to highlight cases, successful cases where evidence was used, and put that added pressure that then encourages governments to use data and evidence to inform their decisions. So we're looking to experiment with all of these alternative approaches that we think can help to naturally incentivize governments to use data and evidence. I'll stop there for now. Back to you, Jeremy.
Many thanks, Christopher. We'll go straight on, Angela, if we may.
Yes.
Remember, we've got round two as well.
Yeah, yeah. Well, luckily, I think Chris just said a lot of what I would share. So I'll just reinforce what he said. Angela Bednarik. I'm here. I'm at the Pew Charitable Trust, but I'm here representing a collective of funders called the Transforming Evidence Funders Network. And this is a group of funders who came together around a real interest in how we could strengthen our individual and collective capacity to support evidence to policy. I would say also evidence to practice and community initiatives, and what that looks like as a group of funders who's really committed to changing our own practices, but also understanding how we could work across our different sectors. And so it's a very diverse group of funders in terms of the kinds of issue areas that we each focus on. There's global development, there's education, and education in national context, environment, and sustainability, and criminal justice. It's a fairly wide breadth of issue areas. But across all of those funding organizations, we have really found, and this is where I'll pick up on what Chris has said, some of those same gaps, which is that as a group of funders really interested in supporting more effective evidence to policy initiatives, we recognize that there are some pretty serious systems infrastructure challenges that keep us from being as effective as we'd like. And we try to tackle those in two ways. One is that we try to learn from each other across these diverse issue areas on how we can change our own individual funding practices. So how has it worked for a funder in working on education in the US to lengthen the period of time that they give for relationship building between researchers and policymakers? And how can we use that? How can another funder use that as a model to maybe make an internal case, or just understand what it would be like to do that well? So putting in place a 1-year planning period for that kind of relationship building we know is necessary for evidence to policy, successful evidence to policy initiatives. So we really focus on that individual change that we think can then build to systems change. But then this group also focuses explicitly on some of those systems changes, and some of those have been mentioned, or those system challenges have been mentioned already. We know that besides the way that funding is structured, not for long enough periods of time, with not an explicit focus on power dynamics, but also just how incentive structures work within research institutions to generate policy and practice relevant research. So what does it look like for a group of funders across these diverse issue areas to really focus on research culture and research infrastructure that could reward this? And the real benefit of working across so many different funding focal areas is that the research ecosystem, the evidence ecosystem, is an ecosystem, right? So you've got to link arms in some way to really get to that systems level change. So that's so we think a lot about those systems challenges. And then I just want to say that I agree with Chris's point that I think there's a real lack of focus on scholarship and understanding about evidence use. So we have a lot on evidence production, we have some on evidence mobilization, but we really need to, as funders, if we're going to structure our investments in evidence to policy appropriately, we need to understand that use, and that needs to be evidence-based as well, right? So we need to be thinking explicitly about that scholarship base. And what we know from working within the community, that there's pockets of understanding and pockets of scholarship. There needs to be more, but they also just could be connected better and more accessible. So as a group of funders, we've been thinking a lot about that, like really trying to strengthen that evidence use scholarship. So I'll leave it there. Thank you. I'm really glad to be part of this conversation.
Angela, thank you very much indeed. Straight on to Beth.
Thank you, Jeremy. It's a real pleasure to be here today. Welcome is a science funder taking on 3 worldwide health challenges: mental health, infectious disease, and climate and health. And while we believe in the power of science to create the knowledge that's going to create that healthier future, we know it can only be unlocked when that science is used through this kind of collaborative action to make a difference. And I think we've heard some really thoughtful interventions here on the changes we need in the system, if you like, the horizontal challenges that we need to get this working more effectively. And so I'm going to try and put that in the context of one of the specific sectoral challenges that we're looking at, and talk about some of the changes that we're starting to make as a funder, while recognizing that we know we have a lot to do in our own development to be able to do this kind of work really well. And of course, we know that research papers on their own are just not enough. And as we heard, you can create the evidence, but that's not sufficient for policymakers to use it. And so a really dynamic evidence to policy interface is so important to make the change that we want to see. And I'm going to focus on the specific example of our work in climate and health, where we're really focused on how can we create a healthier and more sustainable world for everyone, where local communities and national governments are equipped and have the evidence that they need to tackle the global climate and health emergencies with the kind of urgency that we really need them to. And so we are seeking to transform the scale of research in climate and health, and lots of other funders are now coming on board with this too. And a critical part of it is to define the interventions and policies that are going to be successful both in tackling the climate crisis, but all in a way that protects or even improves human health. And that means for mitigation adaptation solutions, we need them to be effective. We need to be relevant in the local context, scalable, implementable, and sustainable. And so the kind of things we're funding, we're trying to work with the communities and policymakers, so that we're taking this systemic view of what needs to change and building in those views at the beginning rather than coming to them too late at the end. So, for example, we've recently funded work on heat adaptation in low middle income countries. We're really there wanting to develop high quality science around what interventions work for heat adaptation, how can that then change policy and practice in a meaningful way. And with G7 countries, we've been creating what we think are quite unique collaborations between researchers and policy actors to ensure that we're creating mitigation policies that can have substantial health effects while having the maximum impact on the climate crisis. And there, I think what is so important is the fact that we're bringing policymakers in at the grant making stage rather than leaving them until the end. And we know, of course, that these, they're significant investments, but this isn't enough on its own. And actually, the most important piece of work I think we're doing in climate and health that underpins all of this is to build a transdisciplinary field to work on this ecosystem that others have talked so compellingly about, so that we are both putting in the funding to drive the evidence, but also creating action from all of that. And I really think changing the models, more of an emphasis on co-production has to be at the heart of this new way of working, and ensuring that those policymakers are engaged at the beginning so that we're not seeing them as an add-on at the end. And I will stop there. Thank you.
Beth, thanks very much. We'll go straight to Hannah, and then we'll have a rapid fire after that, and then questions.
Thank you. Thank you very much, Jeremy, and the World Health Organization for inviting me to this panel. And thank you for all panelists for already providing really in-depth insights into this conversation. So as Philea, we are a membership organization of grant-making foundations and national networks. So we are not a grant maker ourselves, but we are the infrastructure for philanthropy. Our vision is for philanthropy to use its full potential to co-shape a pluralistic, just, resilient society that centers people and the planet. And from that vision, you can already see that the that the E2P approach is very relevant also for Philea as an organization for our members and the wider sector. Of course, improving health is needed to build a better society today and tomorrow. And improving health, we need good policy that is also backed by citizens. And for better informed policy, we need evidence to inform these decisions, also linking up and understood by citizens. And that's one of the areas where I sense that foundations can play a role and have played a role in bridging also in this nexus to the citizens. Overall, just a brief point on Philea maybe. So we have around 200 foundations within our membership with an annual expenditure of around 20 billion euros. And we also have 28 national networks of foundations within our membership. Through those, we reach out to around 10,000 foundations. And we also link up to multilaterals, to universities, to research institutes. The European foundation sector is much bigger. It has more than 150,000 foundations with estimated 60 billion euros of annual expenditure. Here again, more evidence and data is needed because these are just very rough figures. The sector is extremely diverse. We heard some case studies here in the panel, but it includes also within our membership operational think tank types of organizations, those that do purely grant making, and most of them do a mix of all. And we do have very local actors, but also large international actors. And this is something, of course, that you all need to know when you engage with philanthropy and the foundation sector. It's the diversity of it. But what they have in common is that they use their financial and other resources, including networking, building, for the public good. So around 40% of our members are engaged in research, and we have a Philea Research Forum, which comes together on a biannual basis with a large stakeholder conference. And there we also have seen that E2P Nexus has been part of some of the conversations. And how foundations engage around this issue and how our members engage around this issue of E2P, of course, depends on the specific situation of the individual foundations. Its context and how they operate. But just to highlight a few characteristics of foundations that may be relevant in this context. Foundations have a unique ability to innovate and to take the long-term view. They are independent, they act independent, but they're keen to build bridges, and they are keen to collaborate and more with other actors. Can also come in where other conventional funders and government and public funding cannot come in. But what we see is that there's more desire in also collaborating with public actors and bringing in also policymakers into an early stage of activities of philanthropic actors. Foundations themselves, of course, need evidence to take their own decisions in terms of where the funding goes, what activities to pursue. They have potentially the added value of being rooted in society, of being able to link up with other actors, of being able to disseminate also research. More and more foundations are also discussing with their beneficiaries, with their partners, with the view to create more impact. They are also able to bring different researchers around the table. They have a huge networking capacity, and that's where we sense that a lot of action that was also stated by other panelists is needed. Bringing also policymakers around the table, but also bringing other citizens, NGOs, businesses, unusual suspects around the table to inform better informed policy. The point on capacity building, I echo that also for our own sector, but also for, of course, our the partners and the beneficiaries of the foundation. What the COVID pandemic has shown that foundations have changed the way they're working. They have become more agile. They are more engaged in trust or trust-based philanthropy. One of the elements that I would also like to draw the attention to here is that there's more interest in systems change. Of course, this desire for more systems change and less root cause engagement of some foundations creates the question or poses the question of how political can foundations and foundations want to be. So while some foundations are willing to engage more directly also with policymakers to work on policy change, certainly some of them are engaging in funding evidence and research around that informs then policy. Some foundations are also engaging more in infrastructure support around E2P, but potentially there's more to happen there. And one of the other gaps potentially that have not yet been presented here by other panelists is also that there may be need to optimize and bridge also work across the evidence system to enable policymakers to also navigate through the labyrinth of different researchers coming together and different evidence bases that are potentially also having overlapping evidence, and how to navigate through that system. Yes, and certainly the access to evidence is an important one that I think that hasn't been mentioned, that potentially foundations can also play a role there in providing more access to some of the evidence. And what I mentioned earlier certainly is the bridging to evidence, both make evidence and research understood to policymakers, but also to the society at large, since that's also responsibility. And policy, as we see nowadays, is only backed and is only successful if it is backed by society. And that's also where potentially foundations can play a role. And I'll leave it at that for the moment. Thank you.
That's great. Thank you. So that's round one. What I want to do now in round two is ask a question of each of you, but just a minute in your replies. I'll start with Angela, you, and then Beth, and then Hannah, and then we'll come to Christopher and Montassa later. And to be a bit more provocative, not you haven't been provocative, but be provocative. You're a funder. What do you want the community to do? If you push the community, what would you want that community to do? NGOs, WHO, governments, knowledge brokers, policymakers. What frustrates you about that community that you'd like to change? Angela.
Great question. I mean, I think I'd go back to my focus on the systems and the infrastructure, that without really focusing on how we're building these systems for evidence to policy, we're not going to get better in our individual areas, whether it's health or education or sustainability. So we've got to find a way to work on that systems change. And I think in the broader community, I think there's a lot of interest in doing that. And I think there are a lot of good ideas for doing this and, to making those changes in feasible ways. So I think funders would welcome innovative ideas, but feasible ones too. And I think there's a real opportunity here to work hand in hand. So I'll leave it there.
Thanks, Beth. Beth?
So to pick up something that we've started talking about already, research funders often are setting the research agenda through what we choose to fund. And we're good at judging the quality of science. That's what we're here to do. But we are not as close to the issues on the ground as you are in the evidence to policy community. We don't know how the policies are going to be implemented, what's really going to work. So that's where I think the community has a critical role to play. And you can help us understand what those issues are from your perspective. Where are solutions needed most, as well as what might work? And that can be on a grant by grant basis, but I think it's more powerful if you can really convene between yourselves and therefore shape the research agenda and shape how we're funding. So I would really encourage you to be proactive across your E2P collaborations, define that research agenda. WHO actually as a norm setter, I think has a really crucial role to play here in convening that, around the robust scientific thinking, but also really creating the shared agenda for the whole world to follow and for funders like us to follow. And we know that you can't do that. There's got to be a two-way street. You can't do it on your own as an E2P community. We have to be humble and we have to listen to the ideas. But I really think we can't just judge where the exciting science is. We absolutely need to tell you to tell us where we should be putting our money.
Thanks, Beth. Sorry, no, Hannah, come to Christopher next to answer that question. What would you push the community to do if you had a magic wand, which as a funder you do?
Yeah, I think related to what Beth just mentioned, I think it's just I'd love to see more collaboration across the E2P ecosystem, that we begin to break down the silos that currently exist among producers, intermediaries, brokers. And those silos, they could be sectoral, people in health mostly talking to other people in health, or they could be methodological. So people doing RCTs only talking to other people that are doing RCTs and nobody else. And I think because the person that we're trying to help, the policymaker, really doesn't care as much about methods. They only care about making good decisions. And they're currently faced with a multiplicity of decisions because there's so many crises that they're having to deal with. So no single person, no single entity will be able to respond to all the questions that they have. And so I think collaborating, coming together, pooling our expertise, pooling our resources to assist the policymaker, I think is something that I would love to see. And I think as funders, we have an example to set in modeling what that collaboration could look like. So I think Montesa mentioned earlier that we're working together. We're looking to work with as many funders, as many like-minded funders as we can to really model this collaboration and encourage the ecosystem to work together.
Thanks, Christopher. Change the question now for Montesa first, and then Hannah. In your organizations or the network of organizations that you represent, how important is the measurement and knowledge of the return on those grants in terms of impact on policy making, and how would you know if you achieved it?
Thanks very much, Jeremy. Your questions are very provocative indeed, if not simple and very complicated. But thanks very much. You know, as I mentioned earlier, our mandate is supporting research, but it's also research defined broadly in terms of its use, translation, uptake, and learning from the lessons of how this can be done properly. So the return on investment from our point of view is really lies within that sort of evidence to knowledge use nexus. Is it used? Where? How? And what is the learning from this use or this attempt to use it? And there are maybe four sort of I would say maybe there are four categories in a way, but I don't want to make it like it's not a scientific categorization, but just kind of like groups of issues or gains that we look at as in terms of return on investment. One of the first ones is kind of the institutionalizing of evidence use. We have many examples, including from partnerships with Hewlett and with other donors, where we have supported supported efforts in some countries to institutionalize evidence use. We have examples from Burkina Faso, from Colombia. I mean, I won't name them because I won't list them because there are actually quite a few where whether in ministries of health, for example, or in universities, evidence use or research to evidence use units have been established, or centers have been established, and their knowledge and expertise has been relied on and used and benefit by the government or by governments for decision making, to inform the government decision making in relation to COVID-19, for example, choices of vaccines, timing of implementing protective measures. So these are kind of one of the first areas for return on investment for us is the evidence use institutionalized or not. The second area is
We'll have to be quick, Montesa.
Sorry, okay.
We've still got questions and answers.
Okay. I'll mention maybe one more and then we can come back later on. The second area is the evidence. Has the evidence been used for decision making that has saved lives or that has influenced scale up of policies? For example, in the case of Ethiopia, or in case of or some other cases in Tanzania, where we have supported research, the evidence was used again for the selection of COVID vaccines, by the government, or has been selected to modify or the implementation of governments, for example, government policies, for example, in relation to maternal and child health, for example, as in the case in Tanzania. I'll stop here. I can elaborate a little bit more, but these are two of the areas where we decide about how the return on investment. Thank you.
Hannah, one for you, and then we'll have a stretch, and then we'll have questions and answers, which are much tougher than mine.
Perfect, thank you. Yeah, so on the return on investment, I think overall, sector could of course use more E2P approaches in itself also to measure impact on its own action, and foundations, of course, need evidence to take better informed decisions and a deeper understanding of the challenges and opportunities within the communities they work. But I take this on the lens from the perspective of the philanthropy sector. Of course, through collection of evidence, funders can be part of co-creation of decisions, but then of course it is much more they are in this nexus. It's much more difficult to then assess the return on investments, because they would hence be part of systems change making potentially through bridging in this nexus. But it's very difficult for this area of activities to be assessed in terms of impact. One element that I wanted to state in this context is potentially that the E2P approach can also increase the legitimacy of funding action itself, because and can increase trust also into philanthropic funding in this of the sector as a whole. And where it could potentially also have a slightly catalyst effect is that where foundations are coming in with their actions and support, they could potentially also trigger other investors, and here I talk more the traditional investors, to come into such fields, because if philanthropic actors engage, that might also trigger others to come in. Here again, I'm stating that, of course, the return on investment is not understood in financial terms. It's really understood about the impact that that foundations are generating by their actions, and that, of course, is both in terms of social outcomes that they can achieve, and also the long-term effect, but also in addition to that, the relationships that were built. And here again, this coming back to this element of the point around stressing the need for collaboration between policymakers, between the sector, between the scientists, the researchers, already in the designing of agendas around this agenda, but then also the consideration of meaningful partnerships and public philanthropy partnerships in this discourse, where potentially, if the conversations only start once the evidence is produced, it might be too late. So hence the strong encouragement for using this collaborative approach. This was answering slightly to your previous session. Please allow me to come in with a retrospective point for my last points on the intervention.
Anna, you can do whatever you like. But now everyone's going to stand up and stretch for just a minute, 30 seconds, and then we were going to have questions and answers for the last 10 or 12 minutes of this session. So if you want to stand up, now's your chance. Turn the cameras off if you need to dance, but otherwise, take a stretch. Okay, welcome back. I'm sorry, stretches don't last very long on this evidence to policy workshop, but good to see you back. We've got about 12 or 30 minutes, which is longer than I thought we would have, and I'm going to now go to some of the questions and answers. I'll probably try and fuse them together into themes, if that's okay, and might pick somebody out, but please feel free to jump in. Please keep the answers to about a minute. You've got clocks on your computers, I'm sure, or less, so that we can get through as many as we can. The first one goes to this tension that many funders have between being catalytic and supporting the long-term infrastructure of institutions and others. How do you balance that? in your roles as funders. Angela, maybe come to you on that. Catalytic, short-term versus building ecosystems. 45 seconds. Can you hear us, Angela?
Sorry, can you repeat that? Sorry, I was having trouble with my earphones.
Sorry, there's a tension, it's in some of the questions here, between your catalytic role as philanthropy and supporting long-term investment in infrastructure and ecosystems. How do you balance that as a funder?
So I think, I mean, one of the ways to balance that as a funder is also to work with other funders and to have partnerships with other funders, so that, you know, depending on what the mission or the purview of a particular funder is, I'm also thinking about like public funders and philanthropy. There's, you know, very different kinds of resources that can be brought to bear, and different kinds of constraints. But I think the more we can think about like a portfolio of different funders and partners working together, the better. Some can be more catalytic. So, you know, in the US right now, there's a really interesting opportunity with the new National Science Foundation Technology Innovation Partnerships Directorate that is very focused on co-production partnerships and, you know, more traditional R&D investments. But that's a real opportunity for a very large amount of resources to go into these sorts of efforts, and philanthropy different kind of philanthropy who can maybe be a little bit more nimble could help seed, you know, let's say technical assistance or capacity strengthening for potential grantees in that program. So that's, I think about this as a portfolio.
Great. Hannah, another theme that's come through, philanthropy, who's it accountable to, and why should it get involved in policy decision making?
Well, philanthropy, of course, is accountable to the general public if it is a tax-exempt organization, and also as a non-tax exempt organization. Foundations, they do not have members or shareholders, and they do have, of course, the need to be accountable to the general public with the public benefit work that they do. And several, you know, foundations have realized that they have become much more transparent and discussing also, as I said, in the whole cycle of grant making, involving also more potentially beneficiaries, partners, experts, researchers in their whole range of activities. When it gets to active engagement into policy making, that is where foundations are generally have no mandate to engage in party politics. That's excluded. But of course, they provide expertise, network building, and so much more in terms of the whole process of policymaking. And we have seen a shift that foundations have become more interested in also working on systems change. And this, of course, triggers a new discussion in terms of what is the role of the philanthropy sector in this, and where do you draw the line? So the classical division between public, private philanthropy of the different sectors is not valid anymore. There's more boundaries, there's more blurring in between those sectors, and hence there's also new accountabilities and new needs for being more transparent of when do you collaborate with whom, when does public private philanthropy collaboration works, and how decisions are made. In particular, when it's about informing policy, we need to have a very transparent process where different actors' contributions are also explained to the public, so that they understand ultimately systems change where it happens.
Beth, one for you, which has come up in a few questions as well, and you mentioned it. But how do you create opportunities to hear from people about research priorities? How do you do that, and how do you then factor into your decision making?
Oh, it's a great question, and something that we are still working on and learning. We do this really in two ways, I would say. We sometimes have more formal mechanisms where we can use community engagement to go out to communities and to understand their issues and challenges through public perception work. So that is the more rigorous way that we have, and we're still learning how we can apply that effectively. But also, I think being out and listening and being on the ground and talking to our researchers and the communities who we have more first-hand engagement with, who are living in and working with these communities all of the time, I think that openness and dialogue with them to help tune what we're thinking is really, really important. So for me, there's a formal element and an informal role that we have to embrace both of them.
Thank you. Chris, one of those, again, specifically for you, but I think it's for everybody as well, if anybody else. What as funders do you consider as evidence of success in evidence-informed policymaking programs?
Yeah, I think that's the hard question. I think compared to other sectors where the metrics are very clearly defined and you can measure what success looks like, for our sector, I think the measurement is very fuzzy. We haven't really articulated what success looks like. I think there are intermediate steps that we all can look at. I think ultimately we want for evidence use to be institutionalized, that policymakers routinely, consistently turn to data and evidence to inform their decisions. So I think there are things that we can look to as part of that process, which is there demand for evidence? Are decisions being made with evidence? I think the ecosystem piece is pretty important. Like how have we helped create an ecosystem of organizations that are collaborating together, generating high quality data and evidence that is then being relayed to policymakers? How strong are the relationships between those institutions, the brokers, and the policymakers themselves? I think it used to be that in the past, research was just about doing research and publishing, but now we're actually talking about the linkages to policy. So I think that there are all these intermediate steps and metrics that we can look at that show us that we are potentially on a positive path to effecting change.
There's a wonderful book, The Tyranny of Metrics, Christopher. I'll send it to you. Montasa, last one for you, and then I'm going to give you all the chance in about 30 seconds each to challenge the WHO. What would you want from the WHO to help push this agenda forward as a selfish question back to us? You can say what you want, but you've only got 30 seconds to say it after Montasa. What do you see as the role of citizen science, citizen engagement in terms of informing evidence and policy? 45 seconds.
Thanks, Jeremy. I will be very quick. It is absolutely essential. It is actually, I would say, maybe one of the metrics of forming an assessment whether partnerships are successful or not, or evidence use is successful or not. It's not just that there's an uptake by decision makers, but that there's actually, it's a meaningful, engaging, meaningful outcome or process, and engaging citizens and communities in that it makes sense for them as well. So I'll stop here.
Brilliant. Thanks, Montasa. So we've got a couple of minutes left, and what I'd like to hear is a challenge back to WHO in this new transparent era. What would you like WHO to do in 30 seconds, Anna?
Oops. E2P, I was just still on this thought of bringing citizens in, because we see that there is a lack of trust in policymakers. And there is a lack of understanding in terms of evidence. So unless there is a way to bridge better this gap and involve citizens, and I think this conference is a huge step in that direction. So that's a call to action, but then also bridging the different stakeholders, bringing policymakers into the table, bringing the funders around the table, and at early discuss structures that enable potentially co-design at early stages, and hence policy that is really backed also by citizens as a whole and the society as a whole. Thank you.
Christopher, what would you want WHO to do next? 30 seconds.
I think you're already doing this. I'd love to see more of it. I think it's expand the tent to sort of reach across the other silos, the other sectoral silos. I think, as I mentioned, policymakers need a whole evidence on a range of areas. Health is obviously one, but there's just, I mean, the multiplicity of crises that we're encountering today means that if you expand the tent, I think it'll be of service to the governments that we work with.
Angela, push WHO.
Yes, I agree with Chris in expanding the tent and working across issues areas. I think with climate change, there's no other option here, right? Like it's gotta come together, and we've got to learn. I would also say yes to more co-productive and citizen and policy engaged research, but I would push WHO to invest in studying that as they do more of it, to make sure that we're doing it. That's being undertaken in meaningful ways, that we understand how it's working and how to make it better.
Montasa.
Pick up the pace. There is so much demand, and there's so many things to do. There are many great things EVIPNet is doing and WHO is doing. Just pick up the pace. The demands are outgrowing the pace, and we'll all hopefully find ways to support the WHO and other partners and relationships and the ecosystem, but the pace, I think, needs to be even it's good, great, but it needs to be even greater and faster. So thank you.
We'll keep you to the support. Beth, last word for you.
WHO has such a powerful convening and norm-setting role, and I think using that to set the research agenda, tell us what you think is needed, bringing together the amazing intelligence that you have and the communities that you're supporting. So feel like you can boss the funders around.
We've got that in writing. Have we on the line somewhere? Okay, so 30 seconds over. Thank you very much to the 5 panelists. We wish Henrique very quick recovery from illness, and I hope that was of interest to many people on the call, and I'm sure all of the people on the panel would be delighted to be in touch with anybody after this in any way formal through the organizations that they have. So thanks very much. I hand back to our moderator. I think 45 seconds too late, but sorry for that.
Thank you very much, Jeremy, and thank you to our panelists for a very engaging and informative and important discussion into funders' perspectives, priorities, and expectations, and collaborative strategies. It has been an amazing first day for us in this summit. I hope all have enjoyed the keynote speeches. We've enjoyed the presentations. We've enjoyed the panel conversations so far. Before we close our first day, I would like to remind everyone to please remember that we will start our second day tomorrow, same time as today. Don't miss it. We're excited to see you again tomorrow, same time, same place. And please do not forget to visit and join EVIPNet LinkedIn group to connect with each other and continue to engage with your peers and continue these discussions about what is coming out of the summit. And also keep your tweets coming on social media. And I think there's one speaker that is left. Keep your chats coming, keep your questions coming. Let's continue this discussion. We are just one speaker away from closing our session. But also there's one thing that I want to make reference to during this summit. There's journalism by Alex Hughes that is sort of live drawings of the summit. So he's busy on the background doing those drawings. And I think when we have the opportunity, we might have to showcase some of them, or maybe tomorrow. We'll see how the day goes. Without any further delay, I would like to invite our Honorable Minister, Jimena Aguilera Sanuenza, the Minister of Health of Chile, to close our first day of the summit with a final keynote. He's very experienced. I won't go through the bio because of time, just to make sure that we give enough time for what he's about to share with us. Please, Honorable Minister, thank you for joining us, and the floor is all yours.
Thank you. Can you listen well? Hello, can you listen?
Yes, we can hear you. Please go ahead.
Okay, thank you. Good morning from this part of the world, ladies and gentlemen. It is a pleasure to share with you these final remarks. I would like to start congratulating the organizer of this global event, the World Health Organization, through the Evidence-Informed Policy Network, EVIPNet, that have been promoting the systematic use of research evidence in policymaking to improve health systems for nearly 20 years. Several countries in the world, including, of course, the region of the Americas, has developed knowledge translation mechanisms following the EVIPNet guidelines and theoretical frameworks. This global summit marks a significant milestone in our ongoing commitment to evidence-informed policymaking in the realm of public health. We gather here not only as representatives of our respective sectors, but also as advocates for the health and well-being of the population. We're living challenging times. We have the unprecedented opportunity to rapidly access to abundant information as ever before, but at the same time, we need to tackle the risk of misinformation, disinformation, and intensity of visceral discourse that obscure facts in an era of post-trust. Decision-making cannot escape disinformation. In this sense, our duty as policymakers is, in addition to planning wise and effective measures to improve the health of the population, to seek better and innovative ways to communicate health risks, to strengthen health promotion, and to foster transparency in the decision-making process for health, to gain universal health coverage, bringing policymaking closer to citizens. Among the multiple lessons that the COVID-19 pandemic has left us, the need for stable production of timely, high quality, and contingent information becomes evident. In this context, there is a need to increase the financing of research, promote international collaboration, and generate lasting alliance between the producers and users of evidence, both citizens and policy or decision makers, installing structures within ministries that allow scientific evidence both to be translated into an accessible and concrete language for the population and decision makers. Platforms that pave the way to transform evidence into action. Through these structures, we can advance in policies crafted not in isolation, but as the culmination of a robust and dynamic exchange of ideas. Together, we can continue to bridge the gap between research and practice, ensuring that our efforts are always grounded in the best available information. In Chile, my country, we count on decades of experience using data and evidence to inform decision. In the Ministry of Health, it is worth highlighting the burden of diseases and cost-effective studies performed in the 90s, during the 90s, that gave the foundation for the creation of the AUGE, the Explicit Health Guarantees Program, that allow us also nearly 20 years ago to grant access, opportunity, cost coverage, and quality guarantees to 87 priority health problems. Besides, we have to highlight surveillance systems, health, population health surveys, the creation of clinical practice guidelines based on evidence, the evaluation and prioritization process to define the coverage of high-cost treatment, the review of scientific evidence to support health policies such as suicide prevention plan, the redesign of healthcare model in primary care, or exploring the potential extension of the national food labeling regulation, among other examples. Likewise, during the recent pandemic, there were enormous efforts by various actors from the academy, scientific societies, and civil organizations to scientifically advise on the COVID-19 response. For more than one decade, our country has collaborated with the EVIPNet initiative initially through the technical support of national universities, and since 2014, directly from the Ministry of Health, creating the EVIPNet Chile office, which currently resides in the Evidence-Informed Health Policy Unit in the Public Health Undersecretary. We firmly believe that strengthening evidence for policy collaboration and processes favors the exchange of experience and reflection on health strategies that should be implemented or improved at the national, regional, and global level. I invite you to reflect and discuss on these issues, attending the extraordinary session of the 2 days ahead of this event. I would like to emphasize 3 essential points to reflect on, which are also aligned with the call for action defined at the former WHO Global Summit of 2021. First, to strengthen alliance and build trust relationship between users and providers of evidence. Second, to institutionalize structures and processes to support evidence-informed decision-making. And third, carry out citizen and stakeholder dialogues informed by evidence to openly discuss about the barriers and facilitators for the design or implementation of potential solutions to a health policy problem. I extend my deepest gratitude to the research policymakers, evidence brokers, knowledge translation platforms, and all those who have contributed to this endeavor. Our collaborative efforts will yield a legacy of improved health outcomes and will shape a healthier, more resilient future for the generations to come. Thank you.
Thank you very much, our Honorable Minister, for sharing your last thoughts for this day 1. Thank you, everybody. Before we leave the virtual space, please share your feedback with us about today, either in a chat or feel free to use the reaction button. I can't emphasize this more. Please join the EVIPNet LinkedIn group to stay connected with us. Even after this event is gone and dusted, stay connected with us. And I think there was one thing, if I don't do it today, I would not feel happy. Just for a few minutes, I would like Alex to show us some of the journalism that she's been working on, so you can see what I've been talking about, that I've just mentioned a little bit before I say goodbye to everybody. Can I ask Alex to sort of take just a moment to show us what she's been working on, because it's really exciting as well. Alex? Here we go. You can see that you don't have to read a lot of documents. You can just look at these visuals and then see what is really important to you and what you are excited about. So these are really nice visuals of day 1, and it has been an amazing day.
Honourable Minister, thanks very much for joining. I will be in Santiago, Chile in December, and I hope we get the chance to meet at that time. And to our moderator, Susie, brilliant. We should form a partnership. Thank you very, very much indeed, and very best wishes to everybody.
Great. Thank you so much, everybody. I thought this will really be great to close off the session and say good evening to everybody. I hope you enjoyed the session. You can send in your emojis on how you are feeling at the end of this session, so that you can see that we see that we've set the tone really nicely for you. Thank you very much, everybody. Good evening.